Hey everyone. Today we're diving into a drug that has totally changed the game in the fight against cancer. It's called Nivolumab, and it does something pretty radical. It doesn't poison the disease. It actually unlocks the power of our own bodies to take it down.
So let's just start with this one big question. What if the most powerful tool we have to fight cancer isn't some new chemical we invented, but something that's been inside of us this whole time, just waiting for the right key? That's the revolutionary idea we're digging into today.
All right, let's meet the star of the show, Nivolumab. Now, this is not your typical chemotherapy. It represents a huge shift in strategy, moving away from, brute force and towards something way more elegant.
And this right here shows the difference perfectly. Think of traditional chemo like a bomb. Yeah, it's effective against cancer, but it causes a ton of collateral damage to your healthy cells too. Nivolumab, it's completely different. It doesn't attack the cancer at all. Instead, it's like a key designed to do one very specific job: unlock your own immune system. This brings us to this whole new class of drugs called immune checkpoint inhibitors. And honestly, the best way to get your head around them is with a simple metaphor. They release the brakes on your immune system. See, our bodies have these natural safety switches to keep our immune cells from going rogue and attacking healthy tissue, but cancer figured out how to exploit them. These drugs basically go in and cut those wires.
So to really appreciate just how brilliant the solution is, we first have to understand the problem. And the problem is that cancer is incredibly clever. It has developed this masterful disguise to hide in plain sight from our body's own security forces. Inside all of us, right now, we have these soldier cells called T cells. They're constantly on patrol, looking for threats like viruses or cancer cells. But, and this is important, to keep them from attacking our own healthy tissue, these T cells are all equipped with safety switches, or checkpoints. And this is how the deception works. A T cell is out on patrol and it finds a cancer cell. It's about to sound the alarm and attack, but then the cancer cell does something really sneaky. It uses this protein it has, called PD-1, to reach out and press the T cell's off switch, which is called PD-1. It's basically like showing a fake ID badge. And just like that, the T cell is deactivated and the cancer gets a free pass to grow.
So that's cancer's big trick. But now, here comes the countermove. This is where Nivolumab steps into the ring and completely changes the rules of the game.
Nivolumab is a special antibody, and it's been precision engineered for just one job. It finds that PD-1 off switch on the T cell and puts a shield over it. It physically blocks the switch, which means the cancer cell's fake ID is now totally useless. And here's the result. It's night and day. On the left, you've got the deception. The cancer cell hits the brakes, the T cell is shut down. But on the right, Nivolumab is blocking that connection. The brake can't be pressed. So the T cell stays active, it sees the cancer for what it is, and boom, it launches an attack. The disguise is blown. And this is the crucial thing to remember. The therapy isn't the weapon. The weapon was inside the patient the whole time. Nivolumab is just the key that unlocks its cage, empowering the body's own defenses to finally do the job they were always meant to do. Okay, the science is just amazing, right? But how does this actually play out in the real world? Let's take a look at where this incredible tool is being used and what the treatment actually looks like for a patient. Well, the impact has been absolutely enormous. Nivolumab is now a standard of care for a huge range of advanced cancers. I mean, look at this list, from melanoma and lung cancer to kidney, bladder, and so many others. This is not some niche drug. It's become a cornerstone of modern cancer treatment. And for the patient, the process itself is pretty straightforward. It's a clear liquid that's given through an IV. The infusion is actually pretty quick, usually only about 30 minutes, and it's typically done every 2 or 4 weeks in a hospital or a specialized clinic. So taking the brakes off the body's most powerful defense system, that's an incredibly potent strategy, but it's not without its risks. We really need to talk about the unique side effects that come with this approach. They're called immune-related adverse events, and that friendly fire analogy is perfect. What happens is the immune system gets so revved up that it can sometimes get confused and start attacking healthy parts of the body, not just the cancer. This friendly fire can happen in a bunch of different places. Some of the most common targets are the skin, the gut, the lungs, and the body's hormone-producing glands.
Now, while a lot of these side effects are manageable, some of them can be very serious, so they have to be watched closely.
The good news is, doctors have gotten really good at handling this. The first step is often to just pause the treatment and let things cool down. If that's not enough, they'll use steroids to calm the immune system. And in really severe cases, they might have to stop the drug for good. That's why catching these side effects early is so important.
Okay, let's zoom out, because beyond the nitty-gritty of the mechanism and the side effects, drugs like Nivolumab represent a true revolution in how we even think about a cancer diagnosis in the long run. This might be the most incredible part. For some patients, these treatments can lead to these amazingly durable, long-lasting responses. We're talking about the immune system keeping cancer in check for years, sometimes even after the treatment has stopped. It's like the body has been taught a new skill, its own long-term surveillance program. This new approach also changes how we measure success. With chemo, you want to see a tumor shrink right away. But with immunotherapy, a tumor can sometimes look like it's getting bigger on an early scan. It's this wild thing called pseudoprogression. It's not the tumor growing, it's thousands of your T cells rushing to the site to attack. It's basically a traffic jam of immune soldiers. Now, it's really important to have a clear-eyed view here. This therapy doesn't work for everybody, and a huge area of research right now is figuring out why. Doctors can use things called biomarkers, like testing the level of that PD-1 protein on a tumor, to help predict who might benefit. And finally, as a cutting-edge biologic drug, it is extremely expensive, which creates real challenges for access. But at the end of the day, this quote really says it all. For so many patients with advanced cancer, the conversation used to be about surviving for a few more months. Nivolumab has helped to change that conversation to one about the potential for years of life, offering real, tangible hope where options were once incredibly limited. It's a true paradigm shift. And that leaves us with a final pretty mind-bending thought. This entire revolution in cancer care, it came from figuring out how to target one single checkpoint, that PD-1 pathway. It just makes you wonder, how many other switches are there in our immune system just waiting for the right key to be discovered?